All right, hey YouTube world. I just recently had a FUE hair transplant procedure with Dr. Luis Nader, and I really just want to give you guys some feedback. Before actually having the procedure done, I tried my best to do as much research as I possibly could, and it was real difficult finding African Americans. There's one doctor who stated he specialized in African Americans, so he was really the only one that you found with African Americans posted there. So I really want you guys to follow on the process, and it'll actually help you to make a good decision as far as what you're going to do for yourself going forward. So thus far, I'm pretty pleased with everything. I'm 1 week out post-op. Pretty much this entire area that you're looking at right here was like pretty much completely bald, just little hairs here and there, and the crown area was also thinning as well. He was able to fill those in. We did a total of 3,815 grafts. He said approximately around 7,000 hairs, and really it was pretty smooth. I went there. I was down there for really for 3 days barely, and really it was just pretty smooth. The day one I was in there at 8:30, spoke for a while, then we got started around 10 o'clock, and then I was out around 5 something, 6 o'clock, and then the next day started about 9 o'clock, and I was out of there at about 4, and then we were done. So I mean the experience was great. We stayed in the I stayed, should I say, in the Holiday Inn in McAllen. It's nice, centrally located. Everything's right around you. I didn't need a car. I could walk to everything. The mall is directly across the street. The airport is actually walking distance. Seriously. Everything is around you. It's a comfortable environment. You have a pool there, but if you're getting a FUE hair transplant, you can't use a pool. So it's nice to look at. It was actually a pretty cool experience. And one of the things I noticed after the fact was definitely that there's scabbing, and I think one of the most uncertain things that you have as a transplant patient is knowing when it's okay to really remove the scab, or how rough is too rough, how gentle is too gentle. Like, what should I do? I mean, that's one of the big things that you really watch out for. But aside from that, it's been smooth. The Nader takes care of you. He makes sure that you have all the medication that you need. You're on when you're done, just give you a quick rundown. You're on a light steroid as well as an antibiotic and pain reliever. As well as I did start taking finasteride as well as biotin. I'm going to be waiting probably a couple months before I take before I start taking minoxidil. But really, it's just a waiting game at this point, really, to see how effective things are. Hopefully, I wasn't too rough or too rough as far as removing scabs are concerned. But overall, really, I'm satisfied to this point with the procedure, and I'm hoping that everything turns out well going forward. I hope this was helpful to anyone who is African American, who is really looking to see what if Dr. Nader is in fact, a good doctor. I can tell you by meeting him that I have no complaints. He's a great guy. Just a great guy just by speaking with him, and I'm very wary of impressions and people and things like that. And I'm just saying he did nothing to come across in a negative way. Um, he did everything to make me comfortable with the process. Checked in with me throughout. I'm still in communication with him now regarding just progress, medication, things like that. And I'm trying my best to leave him alone a little bit and not bother him too much. So I'm gonna limit our interactions as much as possible. But I'm sure I will be checking in from time to time. Matter of fact, let's check out some of the So actually, I don't know. I don't think I have the balance for it, but no, the donor area is actually pretty sweet. Like no issues or really anything there. He told me if I wanted to, I had like thousands of more hairs that were available that I could use. So that's pretty cool to know. Hopefully, I never need them again. I don't ever want to feel that vein again. And really, one of the things that you come to the reality with is vanity, your own vanity. The That you do care about the perception of yourself through the eyes of others, and so apparent in something like this. But you want to make sure that you're not one of those people that dedicates their life to just being aesthetically pleasing. So, and that was one of the things I really expressed with him, that I only wanted to do this thing. I really wanted to do this procedure one time. It's not something that I wanted to revisit again, because I didn't want to have to come to terms with being that shallow. But so far, so good. No complaints. I was able to go back to work actually 4 days after the proceed of my last day. I was actually able to go back to work, and everything's great so far. But I will update you guys again. I'm at 1 week, 3,815 grafts, about 7,000 hairs, and I will update you when I am at month 1. Thank you so much. You take care, guys.